Hi, members of the Ethics Board. My name is Kai. I wanted to share my thoughts on Luca's case and the ethical issues it raises about end of life care and medical futility. First, it's important to understand that the definition of futile care can be very different depending on who you ask. For providers, futile care is usually about whether a treatment has any real chance of succeeding or working. So if the odds of recovery are really low, then doctors like Dr. Dearborn might see further intervention as pointless or maybe even harmful. Families, on the other hand, will probably see value in continuing care if it gives them more time to say goodbye or helps them feel like they did everything possible. And as for the patients themselves, they might have their own views, and those might change over time. In Luca's case, his advance directive was very clear. He didn't want aggressive life prolonging measures if he had terminal illness. His family supports this, and Dr. Dearborn agrees that more treatment is futile. But Dr. Bernstein, the pulmonologist, believes that Luca showed a desire for aggressive treatment when he was admitted, and he feels ethically obligated to honor those most recent wishes. So this is where ethical principles come in. Autonomy is a very big one. Respecting Luca's right to make decisions about his own care. So normally advance directives are meant to protect that autonomy when a patient can't speak for themselves or they can't make their own decisions. But if a patient's wishes change and they're able to communicate those changes, then those new wishes should take priority. The problem is that Luca's sedated now and he can't clarify what he wants. So we're left with very conflicting evidence. So the advance directive, that's completely opposite of what Dr. Bernstein last heard from Luca. And then there's also beneficence and non-maleficence that are also at play. We want to do what's best for Luca and avoid causing unnecessary suffering. If further treatment is actually futile, so truly futile, then continuing aggressive interventions is probably going to do more harm than good. On the other hand, if there's some reasonable chance of success, then it's worth trying, especially if that's what Luca wanted most recently. As for Dr. Bernstein's position, I think it's important to be cautious since advance directives exist for exactly this kind of situation, to guide care when the patient can't speak for themselves or make decisions for themselves. So unless there's a clear documented evidence that Luca changed his mind after the advance directive, then I think it's best to respect the advance directive and the family's wishes. When it comes to the medical team's approach, I think the most important thing is having open and honest communication. The team should meet with Luca's family and tell them about the disagreement between the two doctors and explain the medical facts as clearly as possible. They should listen to the family's concerns, answer questions, and make sure everyone understands what futile care means for this specific case. In the end, these cases are never simple, but my position is that since Luca had an advance directive, his family supports it, and there's also a lack of clear evidence that he changed his mind, it would be ethically appropriate, so it's okay to stop aggressive treatment and focus on comfort care. Thank you for listening.